Proposal from the Jaitley budget that's been discussed the most is Modicare. The grand, ambitious plan of ensuring that there's a 5 lakh rupee insurance available to 50 crore Indians. Is this just an election jumla, or is this a game changer the way Manrega was before the 2009 elections? I'll be joined on our broadcast this evening by two of the key pilots of this program. Vinod Paul is the health member of the Niti Aayog. This was his idea, which he went with to the finance minister and to the prime minister, an idea that will now be attempted to be turned into reality. Also with us is Union Health Minister J.P. Nadda. They'll be talking about the hows and the wheres of this program. Remember, the Congress thinks it is just a promise, it simply cannot be met. And if you have ever been to a hospital, as all of us have, getting a private insurance, cashless, is a big ask. Trying to get money or trying to get anything done at a private hospital. Here, the government is saying that they will pay the private hospital, and you and I, and especially those who are really poor, will be entitled to avail of this benefit without having to pay. Is that at all possible? We will look very closely at Modicare. But let's show you some of the reactions coming in to Modicare. The finance minister, in his budget speech, introduced a new national healthcare program. The scheme is being touted as the world's largest healthcare scheme. It aims at providing a 5 lakh rupee insurance cover to 10 crore families, which is likely to benefit 37% of India's population. But is the scheme really going to benefit the poor, as is being said, or is this just vote bank politics? Here's a report. Joining us now on this broadcast, Jagat Prakash Nadda, Union Minister for Health and Family Welfare. Also with us on this broadcast is a special guest, Dr. Vinod Paul. He used to be a doctor at AIIMS, now health member at the Niti Aayog. This Modicare scheme is his idea. So we'll talk to him about how he came up with the idea and how he sees it turn into reality. I want to go across to the minister first. You know, you've promised 5 lakh rupees per person for secondary and tertiary healthcare for 10 crore families. Where, Minister, is this money coming from? This is a huge commitment you've made as you head into crucial assembly elections just before a general election year. You've shown the voters this big panacea. Where is the money going to come from?
You see, as the finance minister, Shri Arun Jaitley ji, spoke very clearly about it, he said that money will not be the problem. In the cess, 1% has been increased, number one. Number two, health has also been added with education. Number three, there are sources from where the money will be taken care. It is the commitment, and the commitment of the Modi government is very clear, crystal clear, that we will give an insurance coverage to 10 crore families, and which will include 50 crore people, 5 lakh per month, per year, per family. So that commitment stands. Finance will not be the problem. I would like to clarify here also, Rahulji, that when I took over and when the NDA government took over, there used to be slash in the health budget. But when we came, there was not slash, there was enhancement. And for whatever project we came with foolproof arrangements, the finances were made. For Pradhan Mantri Dialysis Yojana, at that point of time when I announced, a fund of rupees 900 crore annually was provided accordingly. The same way when we came for wellness centers, we were provided funds accordingly. When we enhanced the immunization program, we were funded accordingly. So it is the commitment which matters. Now also there is an increase in the health budget from 27.7% last year, 17-18, and then after that also there is an increase of 5,000 crores. So that is not the issue. The issue is that we stand committed and we will roll out and we will give finance, we will provide finance accordingly.
No, but Minister,
and Arun Jaitley ji, our finance minister, will take care, and we'll do it.
The one question is, where is the government going to get the funds from? The second question is, will members of the family, will citizens have to pay either the full premium or a part of the premium? To what extent is it subsidized? Will people who will avail of this insurance scheme, will they have to pay any part of that premium?
No, no. Absolutely, the government is going to take care. The families are not supposed to give anything. It is the total program of the government with the states, and we will take care.
Former Finance Minister Chidambaram put out a calculation saying that assuming that each family avails of only 50,000 rupees, that's 1/10 of the total insured amount of 5 lakhs, the amount required will be between 50,000 crores and 1,50,000 crore rupees. So where is this kind of money coming from? He's saying you're making this chunavi jumla, which has absolutely no hope of being implemented. He tweeted today to say it's like hoping to fly a kite without a string.
Rahul ji, I'm not in a habit of getting into an argument with the opposition people and with leaders, but still I will say one thing, that he has been calculating right from very beginning, from the first budget, and he has been disproved every time. So his calculations are calculations which is for the sake of opposition. It does not hold any reality. It does not hold any ground. We will do it, our commitment. I said that whatever we have committed, we have done, we will do it.
A lot of comparisons are being made between Obamacare and Modicare. On the one side, Obamacare was supposed to extend to 15% of the American population, much smaller than the Indian population. And on the other hand, you've got Modicare, which hopes to cover 37% of 1.3 billion people. Obamacare failed. Why do you think Modicare will succeed?
Yes, it's a very ambitious program. It's a very ambitious program, and we will make it foolproof so that we are able to deliver the last person the best possible facility, and accordingly we give them the health coverage in terms of monetary support.
The landslide victory of the Congress in 2009 was in part attributed to Manrega. Is the Modi Sarkar hoping that Modicare will be for your government before the 2019 and 18 general elections, what Manrega did for the Congress in 2008-2009?
Sir, I don't compare programs with UPA government, but I say that this is a historical decision, and Prime Minister Modi has been caring about the health issue very sensitively, and he has been very sensitive on that issue. He started Pradhan Mantri Dialysis Yojana, he started free drugs and diagnostic facility, he started the life cycle approach. So all these programs speak about the sensitivity which Modi ji has for the common man, for the poor people, and accordingly, one by one, we are taking steps to ensure that he should get the best health facilities.
Mr. Nadda, when will the first person get the benefit of insurance under your scheme?
We are working on it, and that will be decided very soon. We are having discussion with our seniors, and we'll do it accordingly. And
Okay.
I will come out with a date very soon.
Okay, that's J.P. Nadda, Union Health Minister. Appreciate you joining us. I want to bring in a perspective from the opposition. Dr. Ajay Kumar with us on this broadcast. Dr. Sambit Patra represents the BJP. I want to go across to Ajay Kumar first, because the government is now saying that we will find the funds to implement this scheme. However, the Congress seems to believe that the funds don't exist. The government is saying, why is the opposition worried? It's our responsibility to find the funds, and we will.
Look, Rahul, the first thing is, when a finance minister of the country presents a budget, then you must know where the money comes from. Is this kind of a vision statement of some, some fly-by-night operator? When a finance minister of India presents a budget and presents a program, then don't you, I mean, it's first time, and it's, like Mr. Modi is so fond of saying first time. So first time in independent India's history, where you have the government saying, by the way, we don't know where the money is coming from. We don't know how the scheme is going to look at it. Trust in us, believe in us. I mean, what kind of nonsense? You come, the budget, the revenue is set, the expenditure is set. So why don't you have those numbers? And by the way, the numbers are 2,000 crore. Now, Rahul just explained to me, if the outgoing is 5 lakh crores, which, you know, by any scale of dementia, how can 2,000 crore insurance pay for 5 lakh crore outgoing? I mean, 10 crore family, 50,000 rupees even per family is 5 lakh crores. I'm not saying not the 5 lakh Mr. Modi's promised. I'm saying 50,000 rupees per family. It works out to 5 lakh crores. By the way, 5 lakh crores, we will get insurance companies to pay 2,000 crore. I mean, it's not only insulting to anybody's intelligence, it borders on to being one of the most deceitful exercise in parliamentary history. How can you say that it works? 2,000 crores for 5 lakh crore outgoing cash? Which scheme is that? I mean, I need to know, because
let's
there
go
is something which nobody else in this world seems to know, which Mr. Jaitley and Mr. Modi seems to know.
You're saying it's the world's biggest scheme and you put aside 2,000 crore rupees for it. The opposition and many across the country are wondering, if everybody gets 5 lakh rupees each, that's 5 lakh crores. How will 2,000 crore rupees ensure that everybody gets insurance? How is that even possible? That's not enough. That isn't an adequate provision.
See, Rahul, in fact, the opposition and the people of this country have every right to question the government democratically, and we have the duty of answering them. So let me decipher over here as far as this Namo Care, what you call it affectionately, and what we call it as the NHPS scheme is concerned. As far as the intention is concerned, no one is questioning the intention. As far as the budget is concerned, first and foremost, Mr. Jaitley has answered as far as the collection of money for this particular NHPS scheme is there. Number one, 1% of cess, in fact, would be rolling out approximately 11,000 crore rupees, which is a humongous amount. 2,000 crore rupees is the provision that has been made. This time's health budget has increased by 12% compared to what it was last time. So this also is an extra addition. Then remember, we also have a GST collection, which is rising year by year. And definitely that will also be an add-on. And though I do not like to suggest, but in fact, many newspapers today have come up with the fact that since the last 2 decades, 20 years almost, 1.3 lakh crore is the amount that is pending with the government of the 4 cess collection. Even that amount can be spent. So I believe even if you said that 1 lakh crore was what was required, within this short span of 10 seconds I have given you more capital than what is required for this ambitious project. Secondly, and most importantly, yesterday I was hearing the Vice Chair of Niti Aayog, and please let me complete, sir. Yesterday I was hearing the Vice Chair of Niti Aayog, and he said that by a prudent approach, half of the people, 50% of people would enroll for such an ambitious project in the initial year. Taking a cost of 1,000 to 2,000 rupees per family as the premium for first year would count out somewhere around 5,000 to 6,000 crore. That would be a prudent approach. So I firmly believe with 2,000 crore in place and other economics that I have suggested, this is a big yes, not a no as suggested by the opposition parties. Secondly, we have to remember one extremely important point,
before I go across to the person who conceptualized this scheme.
Rahul. So Rahul, it's incredible, because Mr. Jaitley in 2016 came up with a national health policy. Today in the parliament, he says we are still working out. It was 1 lakh per family was being insured according to the 2016 Bharatiya Janata Party's false promise, and it has not been worked out.
Okay.
Second issue is, look at the performance. The National Food Act promises 6,000 rupees for lactating women. They have only been able to give 7% of the women. So
that's an important counter. Sambit Patra must respond.
You're going to give
that
a premium
scheme
of
which promised 1 lakh rupees to far fewer families was promised by your finance minister in the 2016 budget. You never implemented that. Now you're promising 5 times that amount to a much larger group of people. If you couldn't fulfill your last promise, why do we believe that you'll fulfill this, Dr. Patra?
See, if we go by that kind of scale, that whether we fulfilled our last promises or not, remember the Congress party had only doled out 500 crore rupees for the OROP scheme just before demitting the office, saying that it is almost literally and technically impossible to implement the OROP. But after all these decades of unfulfilling the OROP promise, finally it was the Modi government which fulfilled the promise. Secondly, as far as this NHPS is concerned, remember there was a Rashtriya Suraksha Bima Yojana. 30,000 rupees was the amount which was supposed to go to each family in this net. That has been subsumed into this. As far as 1 lakh is concerned, that has been increased to 5 lakh. Now a comprehensive plan would be rolled out. So I don't see any problem. Implementation of all the major schemes, 18,000 villages been electrified within 1,000 days is something which was thought of being impossible. But it has not only become possible, but it has become one of the flagship programs. We had seen Ujjwala also. We have met our target in Ujjwala of 5 crore women being delivered LPG cylinder well before the time. Now the target is 8 crore women. Similarly, the toilet construction also from 6 crore to adding 2 more crores. Every section of Modi government, every section of Modi's budget has seen fulfillment of the promise, and be assured, as Mr. Nadda was suggesting, we will fulfill this promise. Wait and have a bit of patience.
I want to go across now to Dr. Vinod Paul. He's the health member of the Niti Aayog. Remember, Modicare in the way that it's been rolled out in this budget is actually his idea. It's he who approached the finance minister and then the prime minister, and that's how the government bought into this idea. So we're delighted to have Dr. Vinod Paul on that one idea which is being spoken of and debated widely. Welcome, Dr. Paul. This is obviously a big moment for you. It's not very often that an individual comes up with an idea and that idea then gets implemented and rolled out. Can you explain to us how you see this program work on the ground?
Firstly, this scheme and the program has been envisaged in the government by a lot of us, the ministry and the Niti Aayog and others. This is a path-breaking scheme. It takes us very effectively toward the universal health coverage goal, which is the national aspiration as well as SDG goal. As you know, under this scheme, as a part of Ayushman Bharat program, we intend to cover 10 crore families, which amounts to 50 crore beneficiaries, 500 million people. So it's aspirational, and a cover of 5 lakh rupees would be available to each family for a 1-year period on a floater basis. We will have the scheme rolled out in partnership with the state governments, who will have an equivalent of a state health agency to drive it. And likewise, there will be a national health agency at the center, which will set the rules, which will set the guidelines, which will develop the packages and provide guidance for strategic purchase and empanelment, reimbursement, accountability, fraud control, IT backbone, and so on. So this has been envisaged. We hope to roll out the scheme latest by 2nd October 2018, hopefully even before that. The schemes will be rolled out by the state governments, as I said. We are hoping that this year many state governments will come together, join hands with the union government, and will be taking up the scheme for the people of respective states in this federal structure of the nation that we have.
Dr. Paul, tell me, where is this money going to come from in your view? The opposition has done some calculations saying this can cost anywhere between 1,50,000 crore rupees to 5 lakh crore rupees. How much of a corpus do you think a scheme of this nature rolled out over 50 crore people will need?
Firstly, this scheme, as you know, is targeted to the poor and the vulnerable, not just the BPL, but a class above that as well, to be identified by SECC system. Now, we will not charge any contribution from the beneficiary families. That's the first thing. It will be funded through tax resource that's available to the union government and to the state governments. The estimate that we have, which is based on very robust estimations and calculations, is that we should be spending close to 12,000 crores to 14,000 crore max when the scheme is fully mature in terms of coverage of almost the entire cohort of beneficiaries. Please remember that when you have a large number of people coming into a scheme, a lot of them are healthy. Only a few people would require secondary and tertiary care, which is the beneficiary package, the benefits package. And when you work this out, then the costs are not phenomenal. They are significant, but they are not phenomenal. And we also have suggestions and estimates that actually the cost could even be lower. Because when you do strategic purchasing, when you have participation of the facilities on the basis of volume, the cost can actually come down. However, even if it is higher, it will be taken note of. I think the estimates of the kind that have been put out are not at all reliable. They have worked hard on getting the estimates done. This nation is familiar with the Rashtriya Swasthya Bima Yojana and the estimates and the assumptions that arise out of it. Our country, in almost 20 states, have one scheme or the other, and we know the dynamics of those schemes and the costs that accrues from those. We have erred on the side of a little higher estimate. So I would say, as a start, we believe that a budget of in the range of 12,000 crore or so would be enough. For the first year, however, because the scheme would have a slow uptake, there is a little gestation period before we can move to the implementation. The budget estimate and the budget requirement would be much lower, and a token provision has already been made.
This makes sense.
Whatever more is needed shall be made
Dr. Ajay
available.
Kumar, you've just heard from Vinod Paul, the man who conceptualized the scheme, and what he's saying makes perfect sense. In the first year, you don't need a full allotment because the scheme is still being rolled out, everybody hasn't signed up. And he says this will cost 12,000 crore rupees. The moment the figure comes to 12,000 crores, it is imminently affordable, and he's saying that the citizens won't have to pay, the government will take care of this 12,000 crores. He's talking about volume, he's talking about the amount being capped at about 12,000 crores, which is not the 1,50,000 odd crores the Congress makes it seem it will cost.
Look, Rahul, you know, with due respect to Mr. Vinod Paul, I mean, this is absolutely voodoo economics. We took 5 lakh is the amount per family. Let's take 10% of it. It comes to 50,000. 10% will be the claim of the whole thing. 10% is a reasonable claim, right? So 50,000 into 10 crore families comes to 5 lakh crores. Now, which insurance scheme in the world where you pay a premium of 12,000 crore gives you 5 lakh crore for outgoing cash? Big words, strategic pricing. You are outsourcing it to insurance company who will outsource it to a third-party healthcare provider. So you hope it starts in 2nd October with Dr. Vinod Paul. You hope the state government does it. You hope there'll be healthy people in the scheme. And by your own calculation, Rahul, I'm telling you 10% of the 5 lakhs is 50,000 rupees. You need a premium of 5 lakh crore. I mean, what? And I'm totally amazed. The government, which could not pay even 7 target to lactating women, 7% on the National Food Act, 6,000 rupees to give, they achieved 7%, suddenly says, by the way, we're going to give you healthcare to all Indians. You couldn't give 6,000 rupees to lactating mothers.
You make an important point, and this point,
and
Dr.
you are saying
Patra,
that you can deliver now healthcare.
Is crucial in the context of a private citizen going to a premier hospital, even if he has a valid insurance which he is paying the premium for. You're saying this is going to be cashless. When a citizen tries to use a private insurance, the hospital makes him run around in circles. Here, the hospital has to claim from the government, and you're saying using this Modicare, a poor citizen can go to a fancy hospital and get treated up to the tune of 5 lakh rupees. It just sounds too good to be true, especially given how hospitals give a tough time to citizens with valid private insurance.
Now, first and foremost, let me tell you, with the advent of the new technologies, and especially the Jan Dhan, Aadhaar and the mobile combined, the JAM, and you have seen as to how the direct benefit transfer under this government is being implemented to the extent that almost every year this government is saving approximately 66,000 crore rupees on various projects, which is sending the amount directly to the account of the concerned person. So implementation, of course, is an issue, but remember, with good governance, some of the most tricky issues also can be implemented granted because the intention has to be right. It has to be through the JAM module. Secondly, and most importantly, remember the Rashtriya Suraksha Bima Yojana. In fact, after all calculations, the premium that fell for every family was only 400 rupees. So remember, with this kind of humongous program that has come up with the National Health Protection Scheme, the issue is there would be competitiveness amongst all the insurance agencies. There would be innovation. There would be fighting for a cheaper base. And that's the reason as to why what seems impossible to my good friend Mr. Ajay Kumar would be a possibility. And beginning with what I was suggesting, 5,000 to 6,000 crore rupees initially to roll out the program, and thereafter taking it to 12,000 to 13,000 crore rupees next year is something which has been envisaged, and what Dr. Paul was just now speaking about. I don't think this is a rocket science. We don't have to be a naysayer everywhere. We have to be optimistic, enough of pessimism as far as a budget is concerned. And Rahul, I'll just make a quick point. Mr. Ajay Kumar is also a doctor. I am a doctor. For the first time, budget has drawn discussions into health of this country. Never before, Rahul, you would agree, we would all be having tax experts debating and discussing. For the first time, doctors are debating and discussing.
That's a good point, Dr. Ajay Kumar.
So
let's assume that the scheme is not rolled out perfectly. The other context to this can be that they'll fix it as they go along. So even if it's not perfectly implemented and 50 crore people can't benefit, as you go along, they can keep tweaking it like they have with the GST and try and work towards a less imperfect scheme.
You know, Rahul, the greatest danger of any country is to start believing in these, what you call absolute blatant lies. And I'll tell you what are the numbers. The finance minister said 1,200 crores for the wellness centers. You have 1,75,000 wellness centers. That means 80,000 rupees per center. 80,000 rupees per center. What can you do in 80,000 rupees for a sub-center? But BJP will say, by the way, we have provided 1,200 crores for how many centers? India has got 1,75,000 centers. Now the sense of achievement is so poor. Mr. Patra says that 18,000 villages were electrified. He will never tell you that is average of 6,000. He will never tell you UPA did 15,000. We electrified 1.5 lakh villages. But for them it is a super achievement. The question is the numbers don't add up. You go to the country, you present a budget and you have not made provision. If that is not dishonesty, and you say we are rolling the scheme, by the way, we'll find out how the money will come. By the way, we will do strategic pricing. By the way, the state governments will come and support us. By the way, so many people won't die. By the way, so many people are healthy. I mean, how many variables do you need, Rahul, to make some mockery of, of our intelligence?
Okay,
I would
Dr.
love
Vinod
to have
Paul,
the scheme which
we saw the problem with a scheme like Obamacare in the United States. It didn't go as per plan. If Obamacare didn't succeed, why do you think Modicare will?
Well, Obamacare there are no comparisons. That is a nation which has made a fatal mistake in their health system because they have contracted out the entire healthcare system to insurance companies. It's a problem, it's a system that nobody should emulate at all in the world. It's the worst of the system. With 17% GDP on health, they have indicators which are much lower and worse than European countries. So that's not the comparison. And why it went into difficulties for political reasons and insurance lobbies, and the fact that a universal coverage of this nature, which was bottom up, has never been envisaged. And also remember, United States has no primary healthcare system. And the second part of Ayushman Bharat, which the Honorable Finance Minister announced, is building a strong foundation of primary healthcare and preventive care. By taking these two into account, we are on a very rational path to strengthen our health system. We have significant experience of running these schemes in various states in a different way, and we'll build on that. Have confidence that we will deliver. Okay. We are ready with preparatory work, and we are ready to move.
The ultimate proof will be whether it works or not. Ujjwala does work. People have benefited, lakhs and crores of them. The last insurance scheme promised by the BJP government in the 2016 budget was a non-starter. Which one will it be? We will track this story very closely. Dr. Vinod Paul, Sambit Patra, Ajay Kumar and Health Minister J.P. Nadda for joining me on this broadcast. Thank you very much. But the fact is, for the first time, you're actually seeing a 32-minute discussion on healthcare, which isn't often the case. And if this scheme does succeed, then it will be to the benefit of the people of India. The question is, can they make it succeed, especially with private hospitals? 5 lakh rupees for a poor man to go into a fancy hospital, get treated, that's going to be a tough one to implement. We're slipping into a break.
Thanks for watching the video. For more such news and updates, please like, share and subscribe to India Today. Also check out our other great videos from our channel. We know you will love to.